Welcome to Salinas Valley Memorial Healthcare System's virtual Ask the Experts event. I'm Claudia Otero, and I would like to introduce you to our expert today, Dr. Pablo Romero. Thank you so much for being here today, sir.
Thank you for having me.
Great, thank you. We're very lucky to get your expertise. Well, today we're going to be focusing on vaccines. And if you have questions that we may not answer during this presentation, we ask you to please type those up here on our Facebook page. And at the end of this presentation, we will dedicate some time to answering those questions. So sadly, worldwide, Dr. Romero, more than 2 million people have died from COVID. In the U.S., that number is approximately 410,000. In California, more than 35,700 have lost their lives. Here in Monterey County, 259. And sadly, we lost 4 people here in Monterey County since yesterday. Now, as you all know, after Thanksgiving, we've seen surge upon surge in hospitalizations throughout the country. And of course, that death toll has increased. But we are seeing the light at the end of that tunnel. And, you know, that is partly because of the vaccines. And so that's why we want to discuss this very important topic. In December, as you know, Salinas Valley Memorial Hospital, as well as the other hospitals in the county, received doses of the Pfizer, BioNTech, and Moderna vaccines. The hospital then started vaccinating frontline healthcare providers. These are people who have direct contact with COVID patients. They are our physicians, nurses, CNAs, RTs, and other providers working in the ER, and of course in our COVID ICU units, as well as, of course, the environmental services staff. These are our amazing employees who clean and disinfect these patients' rooms. We, of course, also vaccinated other staff, such as our security personnel, non-clinical staff, other employees, of course, who to some degree have contact with patients who have COVID. Other hospitals in Monterey County have been doing the same thing. Dr. Romero, the most commonly asked question right now seems to be, when will the general public be able to receive the vaccine here in Monterey County?
Well, as we all know, the demand hugely is bigger than the availability of materials. We made the right decision, whoever made the decision to immunize people who have the most possibility of contracting the disease, that is the healthcare providers. And then after that, of course, the senior citizens at the nursing homes. The pipeline is there and is being modified day by day. And I know that the state has said that people who are 65 and older can get the vaccine. The problem is trying to identify who those 65-year-olds are is very difficult. Nonetheless, the most important lesson to learn today is that if you have questions as to when is your turn, you need to go to the health department via telephone call or online and see when there's a chance that you can get it. Please, whatever you do, don't call your doctor's office and don't call your clinics, because nobody has control over these except the health department. There's a lot of people who need to have their refills of medications, and the lines can be jammed by people asking, when can I get my vaccine, when that is not necessarily up to the doctor's office or to the clinic. So anyway, it's the health department, and you can see online when you go to the health department that they can probably sign you up to go maybe next week to King City or to Marina if you meet the requirements of being 65 and over. As far as the general public, it looks like probably sometime in the early spring we can probably see more of that available. There seems to be a possibility of a third vaccine being available. That is the one in clinical trials from Pfizer, from J&J. But again, the important thing is get your name on the list and get on the line, and then wait for your turn.
And I do want to show our viewers the Monterey County website. It's there on the screen, so you can go there for more information. You can have that information in English and in Spanish. It's montereycountycovid.org. You can also call that number. It's 755-4500. 877-555-4500, and that really is the best place to look or to go to for information. Dr. Romero, getting vaccinated is very important. There are a lot of people out there who are afraid to receive the vaccine. They are worried that it was developed or that the vaccines were developed very quickly. If you can share a little bit of history in terms of the vaccines that we currently are using, were some already in pre-development? Can you share some light into that?
Well, as we all know, we had the chance of looking at a model that is very close to these particular virus with the SARS and the MERS. Those viruses came into being, and of course, we all got worried about them, and then we developed prototypes of vaccines. Then the viruses disappear on their own, and nonetheless, all that data was gathered and stored. And then when about a year ago that the cases started coming up in China, and then the DNA sequence was published, we realized that there was a model already there. And so it wasn't like somebody came up with a dream to make a new vaccine, but it was we utilized what we had available, and then we put it together and decided that it was okay to use it in simple clinical trials, first in animals, and then in humans, and then in larger numbers. And of course, eventually it got to the 40,000 or 44,000 people who got, half of them had the vaccine, the other half got the placebo, and then you can measure the amount of antibody response, and then it comes out. It looks like it was fast, but to me, it was not fast enough, because that's how we ended up with 410,000 people dead. So it is faster than usual because we have more technology available to us. But it's not like a dream vaccine. It was already in planning. We just utilize the resources to be able to produce the final product.
Okay, thank you for answering that question. There are also a lot of people who think that when you get that vaccine, they're actually injecting a virus into you. That's not true.
No, what it is they're injecting a bit of the DNA sequence or the RNA sequence into your body, which is completely synthetic. It doesn't come from any live virus of any sort. You just have the DNA sequence that you put into a messenger RNA particle, and then you envelop it in whatever material that you want to use to inject it into the human muscle. Then the cells pick up that instruction set to produce a lot of antibodies. But there is nothing viral, there is no bacterial, there is no writing particles on anything. It's just a simple chunk of DNA, messenger RNA, that is injected and to get the cells, your own cells, to produce the antibodies against the COVID-19.
In other words, the vaccine will not give you COVID-19.
No.
No.
The vaccine will give you protection against COVID-19, but not the illness.
Right.
The COVID, as we all know, is coronavirus, and then the D is the disease. So it'll probably give you corona, but they will not give you the disease. It'll give you corona protection.
Got it. Okay. So there are a lot of people that are saying that they are experiencing certain side effects. Can you describe what some of those side effects are after receiving the vaccine? And why does that happen? What is your body telling you when you're feeling those symptoms?
I think you should feel very reassured that if you have side effects, because that means your body is responding to what you injected into your system, and it is going to work really, really fast to produce the antibodies. So you may get some chills, so you may get a localized pain, or you may get some body aches. That just tells you that your body is working really hard producing the antibodies required to protect against the actual live virus.
Now, we have two vaccines here in the U.S., the Pfizer BioNTech and the Moderna. How effective are they?
They're both about the same category, and that is the 94.5 or 95% effective, which is, of course, too bad there's not 100%, but there's hardly anything out there that's 100%. I think 95% is way better than being exposed to other things. They're both very similar.
Okay. Is it absolutely necessary to receive 2 doses? I mean, what happens if you only receive the one? Life happens, things happen, and you don't go back for that second dose.
Well, I mean, you should try to stay to this schedule of the 3 weeks for the Pfizer and 4 weeks for the Moderna. What happens, of course, people move to a different country, a different part of the world, or whatever. The model was made for people to get a booster reaction on the second one. What happens? You probably are just not as protected. Try as much as you can that if you go to one place to get your vaccine, please go back and get the second one. You can probably delay it 2 or 3 weeks, but even if you do delay it 2 or 3 weeks, don't forget it because it is giving you more protection as time goes by.
Okay. If a person is vaccinated, can they still get infected? And if so, even with the vaccine, can they still transmit it to others?
Well, again, it's 95% protection, so they could probably get infected with a different mutation of the virus. But even with that, I mean, you are likely to have less infectivity, hopefully, and hopefully you're not as infectious. So you should try to get vaccine. And then, of course, the more people around you get vaccinated, then there's less of a chance for the virus to adhere to any of you. That's how we were hoping to get the herd immunity. And what's the number? I mean, the number that's being thrown around is 70, 80. I mean, I think 80, 90% will be better, so that the virus just slices off and goes away into never land if it finds no places to adhere to and eat.
Can a person receive one dose of the Pfizer and one dose of the Moderna 3 or 4 weeks later? I mean, what are physicians out there or the medical world saying about that?
We're trying as much as we can to have people stick to the one model, because we don't necessarily, nobody has run the experiment of doing half of one and half of the other. So we really don't know. Sometimes people have a reaction to one, and so then that's the time where you may need to check with an immunologist or an ID person to see if you develop a reaction to one, or should you get the same one or the other one. But in general, no experiments have been made to see if you can do one or the other. I think you should try to stay with the same brand.
Okay. Thank you for that. And right around the time that the Pfizer vaccine was released or approved for use, we started hearing about a different variant, the UK variant, and then there were other variants, and now we have several in the US and in California now too. What do we know about the vaccines? Do they protect against those variants? Or is more research being done? What can you share about that?
Research is being done all the time about these things, but so far what they've been able to see is that there's a minor DNA sequences on the viruses that are coming up. Viruses are always at a huge pressure to come up with mutations so that they can get better. But so far, it looks like the antibodies that are being made protect against all of the variants. The one in Brazil may be a little bit different, and we don't know that yet. But nonetheless, since we have nothing else to utilize the one that we have. And at least you get some level of protection, and perhaps if you don't get the full 100% immunity, you're going to get as much as possible. So I think until we come up with a better brand for different branding, I think you can just reassure yourself that you're doing everything possible to get immunity.
What can you tell us about whether or not this is going to be a vaccine where we're going to have to, that we're going to have to receive annually, or maybe receive a booster every so many years?
So it's too early to tell. Obviously, this is the first messenger RNA vaccine, and we don't know what the level of antibodies being made. How are they going to be functional 6 months or 12 months from now? We're hoping that it'll be a two-time event. Nonetheless, as time goes by, we need to continue to do the research to see if the antibodies are wearing off or not. We don't know. And if we make the type of antibodies that are going to be in circulation for a long time, then we're fine. But as you know, most of the child immunization schedules require 2, 4, and 6 months of immunizations, and then 1 year, and then 15 months. And then, after, of course, then when they're ready to go to preschool, they get another shot. what's the big deal? If you have to have a shot now and then, who cares? We're doing the same thing with influenza. Every year we go out there and the virus mutates and you get another shot.
Right. Okay, only time will tell. But the important thing is that research is being conducted and we will know at some point. But protection is here now, so we should get vaccinated when those vaccines are available.
Absolutely.
Okay. Another frequently asked question, can pregnant women or those who are breastfeeding receive the vaccine?
That's the kind of question that I think people need to bring up with their own docs. And so far, all the obstetricians that I've spoken with, I can't imagine anybody having advice against it. We all have seen active COVID pregnant people who end up having cesarean sections and complications from those things. This is before the vaccine was available. And so I as far as I know, everybody is saying that, yes, you should get that because there's no other alternative. Breastfeeding, as far as we know, immunize the mom so that she doesn't have a chance to then pass on an infection to the baby. The antibodies that are secreting in the breast milk are not going to hurt anybody if that's the case. So I would say yes, but do check with your doctor.
Okay, check with your doctor. That's great advice. What about a cost for the vaccine? I know that other states, for example, you can go to a stadium, whether it's football or baseball or even a mall parking lot and do a drive-through, you get the vaccine. Does it cost anything? Does your insurance get billed? How does that work?
So the vaccine is actually funded by the federal government 100%. The only possible charge will be for administering the vaccine. And that usually tends to be in the neighborhood of $10, $15, $20. And as you know, for us at the hospital absorbs all those costs. If the local government has any brains, they probably we can do the same thing. Okay, so set up the 49er stadium and then have people in Santa Clara kind of go out there and get immunized, and then the county can pay for that. I mean, it's cheaper to pay for an administration than to watch the loss of revenue from decreased activity from the public working or consuming things.
Okay, all right, that's good information to share. Thank you for that. I saw this one question on a social media site, and it brought a smile to my face, but I thought it was really important. And it was a grandmother asking a physician that, when she gets vaccinated and her daughter and her grandkid, well, not the grandkids, but her daughter and husband get vaccinated, can she go see them? Can she hug them at that point? Basically she was asking, can I hug my family once I have been vaccinated? What would you say to that?
What I can say is that the vaccine so far is giving you 95% protection. And what is so precious about a hug that can wait a few more months until the virus has been neutralized? It's okay. They know you love them. They know that you can maybe shake their hands with their elbow. They need their requirement to have to hug somebody. I think it can wait a little bit. People understand you. Why run the chance of saying that you got immunized, but somehow something happened, you got one of the variants, and then you gave it to your grandma? Or it's, most of the time it's going to be the younger people are going to have it and not even know. They're going to be asymptomatic carriers. And then what if they give it to grandma, and then since she's only 95% protected, well, the 5% is still there. Why chance it?
Wait a little longer, take those extra precautions, and you can hug them later on, maybe next Christmas, right?
Absolutely. And there's going to be many, many more Christmas after that. We just don't want to have to think about funerals or any of that stuff. So no, it's okay to wait. People know that you love them, and people know that, it's okay to wait. No need to break the barriers yet. You need to keep the barriers for the virus to slide off of you with immunization, active immunization with a shot, or with physical barriers as well for the time being.
And I do want to point out, we are not wearing our masks right now, and that's because we are probably about 12 feet away, but we do feel safe. I know that you've received both doses of the vaccine, but as soon as this is over, we will put those masks right on. And in fact, the other folks in this room are also wearing their masks, and they're definitely far away from us. So we are taking the necessary precautions. I do want to actually turn now to some of the questions that we are getting on Facebook. Stephanie here says, should we have the vaccine if we have already had COVID?
The answer to that is that if you had COVID and was treated locally, that is, you stayed home and had nothing else given to you, absolutely get the vaccine. If you had COVID and you got hospitalized or almost hospitalized and you got the antibody treatment, you probably should wait 3 months because you're going to get a stronger reaction. If you've already had the COVID and you want to give your spot to somebody else to get the vaccine because you feel that you're already at least partly protected, that's up to you. That's a very generous offer. But on a simple, manner, yes, go ahead and get immunized whenever you can.
Whenever you can. Juan Romero here on Facebook says or asks, do you recommend to have the antibody test to see if we have had COVID-19 in the past?
That is probably one of the more useless tests to do. The science is just not there. We have the data is all over the map, and most of us can make sense of the antibody test. So no, I don't recommend that because it could have been a cousin of COVID that gave you the antibody test. And so we don't have a specific antibody test that says, yeah, this is exactly COVID-19 that you got 3 months ago. So don't utilize that stuff. Don't waste the time. I don't think it's worth the energy to do that.
Another question that keeps popping up here, and we did discuss this earlier, but hopefully you can answer this question once again in case people started watching a little late, is when will the vaccines be available to the general public here in Monterey County?
We're hoping that the pipeline is going to be a little bit more streamlined. Obviously, there's a lot of millions of doses that are somehow going from the factories to the Monterey County Health Department. And it looks to me like perhaps early spring, especially if the likes of Johnson & Johnson's data continues to be where it is, which is they're going to clinical trials, phase 3, and they are already preparing to produce those products and then send them. I think the U.S. has contracted for 100 million. So I'm hoping that early spring will be the time to have everybody else, other than the phase 1, which is A, B, and C, healthcare providers and whatever is out there. For the general public, I think, because we are already recommending the 65 and older to be immunized. But regular people, I think early spring.
Okay. Crystal Delgado is asking, when will a vaccine be available for children?
The clinical trials are being conducted right now, and they're the lowest age is 12. They're doing one on 12-year-olds and higher. The other one is 14 and higher. And as you know, right now we only have 16-year and higher. So when is that going to be available? Whenever the data gets collected and make sure that they didn't have any weird reaction. So probably during the year.
Here's a question that's coming in actually in Spanish. So let me translate very quickly here. Betty Esparza, she's asking, what about people like us who have certain illnesses where our immune system is low? Will the vaccine help us?
Absolutely. The idea behind fortifying the immune system via an injection, of course, is a good one. If you already lack immune defenses, yes, give yourself the shot so that then you can produce antibodies to help you build up your immune system. Yes.
Okay. Would you mind answering that in Spanish for Betty Esparza, who's watching us in Spanish?
La idea es de que si le falta la defensa por el sistema humano inmune, a que se vacune para que se regenere mejor la defensa y que pueda protegerse contra el virus.
Okay. Thank you very much for doing that. Maria Elena Correa Ortiz, are there any meds that can affect the vaccine?
None that we know
of. Okay, good. And we already talked about pregnancy and whether or not you should receive it if you are, or if you're breastfeeding. What about people that are undergoing chemotherapy or radiation or immunotherapy? Can they or should they receive the vaccine?
They should, because when you undergo chemotherapy and when you undergo radiation therapy, remember, you're being exposed to other people. I have seen some outbreaks of COVID in some of the centers that have oncologist offices. So why not go for your oncology visit where some of the clerks may have it or some of the technicians? Why not go there with the protection of the immunization? Absolutely. Be immunized. And so that if you have to sit there and get the radiation, and that maybe people were not as thorough as they should have cleaning the machine to give you the radiation, and they can give you the virus. Instead, go there prepared to repel the virus after you have your vaccine.
Okay, great. Thank you for answering that. What about people with comorbidities such as high blood pressure, obesity, diabetes?
They need to get ahead of the line and absolutely get immunized as much as possible, because as we know, a lot of the bad outcomes included, of course, diabetes is a good one, and of course, morbid obesity is another one, because you're not taking deep breaths enough, you're not defending yourself against this virus. So absolutely, they probably should be ahead of the normal 25-year-old athletic person. Yes.
Okay. Another person asks, if I've had an allergic reaction to another vaccine, should I still receive the COVID-19 vaccine?
You should receive the vaccine, but do tell the people who are taking the data that you have had a reaction, because as we know, most vaccines have different components in them, but there's none that necessarily share the chemistry makeup of the COVID. So my take on this is that you probably should get immunized, but then do tell the immunizer that you have this reaction.
Okay, very good. Is there anything else you want to add regarding the vaccines and why we should be getting vaccinated?
Well, the most important thing is that obviously we're trying to get to the herd immunity. At the same time, we need to do that in an organized manner so that we get our turn to get immunized, and second, not to overutilize the telephone calls to your offices, to the doctor's offices, or to the clinics, because they have no control over the availability of the vaccine. Please go to the health department website. Please call the number and get in line, and get ready for when they call you. And if it's going to be next Tuesday or next Wednesday, I've seen it with some of the staff who are not affiliated with the hospital, who get an appointment, and by the way, they had nothing on Friday, but they had something on Tuesday. So go ahead and get it done. Get online and get ready for and if you have to, I know somebody who actually had gone one day to San Luis Obispo from Salinas, and they drove back to get their vaccine. That's 4 hours round trip. And people are taking this very seriously. The illness is serious, and the vaccine, whenever it becomes available, take it.
Take it. Okay. I also want to mention very quickly that if you think you may be experiencing COVID-19 symptoms but are not sure, please call Salinas Valley Memorial Hospital's COVID-19 hotline. That number is 755-0793, 755-0793. Dr. Romero, in the meantime, before the general public is vaccinated, and you said it earlier, before we reach herd immunity, what do we need to keep doing?
We need to keep on using these things, and we need to keep on using a lot of sanitizers. We need to keep maintain the social distancing of at least 6 feet apart. We need to assume that people who are walking in front of us have it, and we need to protect ourselves against the possibility of them giving us a contagion. So glasses when you go for walks, yes. Having your mask, at least, if you go on a long hike with nobody around you, you don't have to have the mask on your face necessarily, but have it ready in case somebody comes around the corner. But just keep to making sure that the virus that somebody has doesn't attach to you. And keep on doing that until we are the herd is completely immunized.
Okay. I actually have a couple of other questions that just came in, so let's take a couple of minutes. Gina wants, she's asking, I read to avoid Tylenol and drinking alcohol before having the vaccine. Please comment on that.
Well, Tylenol and alcohol is not a good mixture because they both get, managed to the liver. So I would drink a lot of water, and then if you're having to take Tylenol, there has to be a reason for it. So you may, unless you have a need for it other than fever, I would probably give yourself a break. Is it going to interact with you? Not necessarily, because the vaccine is going in your muscles, and it's going to start getting the muscles to produce the antibodies. As long as you don't go drinking alcohol and getting your Tylenol and then going back to drinking more alcohol and more Tylenol. No. If you develop aches and pains, then try ibuprofen, water, and hold off on the alcohol.
Okay, hold off on the alcohol. Allison Mercer, is it okay to get the second shingles shot about a week after the first Moderna vaccination?
No problem at all whatsoever. The shingles vaccination has a whole different model. So you can probably get them at the same time if you wanted to, so that's not a problem.
Okay. And I think one more question here from Olga Quintero. She says, thank you for doing this. If you had COVID already, can you still get the vaccine?
You should get the vaccine as long as you're in line to get it. Absolutely, because there's the mutations and the fact that you only have so much protection after having the vaccine. I'm sorry, after having the illness. And even with the vaccine, you're up to 95%. So yes, absolutely, get the vaccine.
Get the vaccine. Well, I want to thank you, Dr. Pablo Romero, for being here today and for providing us all this information. And I want to thank you, our audience, for tuning in and, of course, for asking all these really good questions. We really do appreciate your time and, of course, your time, Dr. Romero. And that's going to do it for us. Please do share this video. It will remain here on our Facebook page. We ask you to please give us a like. Share it. It's valuable information. It can save someone's life. This is a very fluid situation. We still don't know when those vaccines will be available for the general public in Monterey County, but I do suggest that you do check the Monterey County Health Department's website. You can go on there. It's in English and Spanish, and that absolutely is the best way to stay informed right now. I'm Claudia Otero. Thank you so much. We'll see you next time.